This is the Fatboy Show on RX Radio, and I hope you're keeping healthy because you wouldn't want to fall sick, not in this country called Uganda. Among the reasons why you wouldn't want to fall sick is, God forbid you wind up at any one of our hospitals. Will you even get good treatment? And what if you can't pay? Might they make your mother do hard labor in order to offset that bill? Well, that's what happened to Margret Iloku, a 63-year-old woman who has spent almost 2 weeks weeding a groundnut garden belonging to one of the nurses at Princess Diana Health Center 4 in Soroti City after failing to clear the medical bills of her daughter-in-law, Grace Acen, who apparently was admitted to the facility after she had a cesarean birth. So think of it. So this lady called Grace, had a C-section and could not pay the money for it.
Yes.
And so the mother-in-law was made to tend to the gardens of one of the nurses.
So as to be able to clear the bill. Now, this is what happened.
Isn't that illegal?
It is illegal to start with. And this hospital has been on the spot several times of what's that thing?
Yeah?
Like of
what?
What's the word? Not
Corruption?
Something to do with corruption, where they get money by false pretense from patients. Extortion, yes, that's the word. This is not the first time. So what happened, this lady, 63 years old, she has joint pains, by the way, and one of her legs, or she has arthritis in one of her legs. So they go to the hospital, they are told that they need to buy jik and some other items that mothers to be are supposed to buy from outside the hospital because they don't have them. Please note, in government hospitals, most services are supposed to be free. The mama kits, the Ministry of Health has said on many occasions that mama kits are supposed to be free, but they make the women buy these. So the lady was supposed to push, which was supposed to be 150,000 shillings.
Natural birth.
Yes, natural birth. So the mother-in-law goes to tend the garden of one of the nurses, and she got this information from one of the patients, like the carers, of if you don't have money, find one of the workers, tend their gardens, and then you will be able to pay the bill. Turns out that the lady failed to have a natural birth. Then it had to be a C-section where they had to pay 300,000.
Wow.
So the lady has already been discharged. It's been 5 days, but the mother-in-law is still tending to the garden because she needs to do a work worth 300,000 shillings.
Well, so my question would be this: what would be the alternative here? Because on the face of it, I guess we might all just want to condemn these nurses, right? But at the same time, if a patient is unable to meet the cost of a treatment, how is the hospital meant to recover the money?
So you see, it's not even the hospital that is telling the patient.
It's the nurse.
It's the nurses. It's like how someone comes to RX Radio. They want to record a podcast. They don't have money to pay for a podcast. By the way, we do take in people who want to record podcasts. So if they don't have the money, I'm like, oh, by the way, the laundry at my home is not done. So if you remember, I'm just an employee at RX Radio. So they come to my home, take care of my children, tend my garden if I have one, and then I allow them to record a podcast. How is that okay? If you learn about it as the proprietor, would that go down well with you?
Of course not. It wouldn't. So I guess if the hospital itself wasn't taking steps to reclaim that money, then really these nurses were not acting ethically and probably acted criminally in extorting this woman because she honestly did not need to have to do this. And it's even made more tragic by the fact that, she's an elderly woman, 63.
She's 63 years, has arthritis. Why would you do that to her?
And you know what? Let this go down in history as being one of the best mother-in-law, daughter-in-law relationships we have ever seen. Because typically they don't get along.
I know. When I saw that, I was like, so where is the baby dad in this? Why are you letting your mother go through this? And honestly, I'm giving her flowers.
So I think going forward, this woman is going to show her mother-in-law tremendous respect.
I think it has been there. That's why she would have to go an extra mile for her.
So you think the mother-in-law must have had so much appreciation for this lady?
Yes.
to have been willing to do this.
Yes.
So if you are one of these proud city girls who can't greet their mother-in-law, you don't check on your mother-in-law, you don't make her a cup of tea when she visits, you can't expect her to be willing to do this for you.
She wouldn't do that for you, but then you also open another, paradigm as far as mother-in-law, daughter-in-law relationships are concerned. I know as a woman raising a son, I see the bond I have with my son, and I understand why sometimes moms can't let go. Why moms have a bond with their sons sometimes that feels weird to their significant others.
Right.
But also as a woman, I'm also like, okay, so you found this man with his mother, and because some women just hate mother-in-laws. She has done nothing to you, and you just don't like the woman. You're like, mother-in-laws are already like that. You come in with your stereotypes.
Like Hakimi's mom.
But you see, when you talk about Hakimi, this is the thing. Every woman wants a son like Hakimi, but they do not want a husband like him. Make it make sense. Because at the end of the day, your son may be Hakimi. How about the husband, especially if you're looking for one?
And I think that point is clear to understand. But most women would want their sons to not be exploited. If your son brought home a girl and it appeared like she had nefarious intentions, I'm sure you'd intervene.
If she had nefarious
you
intentions,
would say, but son, are you sure about this woman? She's,
and I'm asking, thank you for putting it like that, because there are mother-in-laws that just come in and they're like, you can't be with her because I said so. She doesn't seem right to me. Like, you've not even taken the opportunity to get to know this woman. But these are really tough dynamics, because on one hand, the boy loves his mother and he loves his wife. But this is my sentiment here. If you have to choose between your wife and your mother, then probably your mother didn't do a good job. Because if your mother did a good job, she will rest assured that it doesn't matter which woman you're going to fall in love with, you will always love and respect her, but you also owe your wife love and respect. You can be in the middle. It's like, I have children. If I met a guy and he told me, choose between your children and me, I'm definitely not going to choose him, because I want to be with a man who is secure enough to know that she has children, she loves them. The kind of love she has for her children is not the kind of love she has for me. We can both coexist and be happy.
Now, what about the fact, and just to go back to the story of this woman, apparently she was not allowed to leave the hospital.
Oh, so she didn't just choose to stay. She was asked to stay behind.
Right. She says that she couldn't go with the patient after she had been discharged.
Yes.
Since they were still pending bills to be cleared.
That's true. Yes. That's why I said she stayed behind so that she finishes doing work worth of the money that she was supposed to give to the hospital.
Wow. Anyway, much respect to this lady. I wish, there were ways that she can be reached out to. I'm sure if, I saw it was the Daily Monitor that reported this. I wish they had maybe put out like some sort of crowdfunding initiative so that someone who may want to assist this woman can. I'm sure within seconds they'd have been able to raise the money to settle this debt.
Maybe we can start a campaign. We start by finding the right of the article and then see if we can get to the lady herself.
Well, now that you mention it, maybe let's try and do that. Let's try and learn more so that if it's still a pending issue, we can try and see how we can help out, and if it's been resolved, because I'm sure by now a good Samaritan or two must have reached out.
Yeah, because what is 300,000?
Yeah. Okay, well, you're our hero, Miss Margret Iloku, 63 years old, tending to a G-nut garden just for the sake of your daughter-in-law. You are a role model
but for the sake of her grandchild also. Let's not forget that.
That too.
Because we seem to have forgotten that the child born was actually her grandchild.
Well, I mean, nonetheless, it's still a warm gesture that she did. So she should be admired for that.
Yeah.
Keep listening to The Fatboy Show.